What ethical dilemmas affect patient rights in lymphoma? Imagine facing a serious health diagnosis like lymphoma and feeling overwhelmed by tough choices. Ethical dilemmas often come into play, especially when it comes to respecting patient rights. One major issue is patient autonomy, which means patients have the right to make their own health decisions. To do this properly, doctors must give clear, honest information about the diagnosis, treatment options, risks, and benefits. But sometimes communication isn't enough, especially if patients have limited health literacy or come from different cultural backgrounds. Ensuring they truly understand their choices is vital to respecting their autonomy. Another tricky area is the right to refuse treatment. Some patients, including young adults or minors, may decline recommended therapies like chemotherapy or blood transfusions. For example, a teenager might refuse a blood transfusion that could help their treatment succeed. Medical teams then face the challenge of balancing respect for the patient's decision with the duty to save lives. Courts sometimes get involved, especially if the patient is a minor. In some cases, a mature minor may be allowed to refuse treatment if they understand the risks, but this can be controversial. Respecting a patient's right to refuse treatment is important, but it can also lead to difficult ethical questions about life and death. Truth-telling is another sensitive issue. Doctors are ethically obligated to be honest about a patient's diagnosis and prognosis. However, families or cultural norms might prefer withholding bad news to protect the patient's feelings. For example, some families want to shield a patient from distressing information, but this can conflict with the patient's right to know and make informed decisions. Doctors must find a balance, being truthful while showing compassion, and respecting cultural differences. Fair access to treatment also raises ethical questions. Lymphoma treatments can be costly and resource-intensive. Patients from different backgrounds or countries might face barriers like language or limited healthcare resources. Ensuring everyone gets fair treatment regardless of their background is a core principle of justice. Healthcare systems need to balance resource allocation carefully so that no one is unfairly disadvantaged. Conflicts of interest can also threaten patient rights. Sometimes healthcare providers or institutions might have financial incentives or institutional pressures that influence treatment decisions. This can compromise the quality of care or patient autonomy. It's essential that medical decisions are guided by the best interests of the patient, not external influences. Addressing these dilemmas requires a team approach, including ethics consultations, clear communication, and respect for each patient's unique situation. Patients and their families should be supported with education and counseling, helping them navigate complex choices. Ultimately, respecting patient rights in lymphoma care means carefully balancing ethical principles like autonomy, truthfulness, justice, and beneficence while following established medical standards. Always remember, personalized advice from healthcare professionals is key to making the best decisions for each individual.